Good morning. Welcome. Oh, or I guess I should be saying good day. Good day, mates. Good day. Thank you for coming. You are at Stepping Up from Vulnerability to Opportunity, HIV and AIDS in the Global Context of African, Black, Migrant, and Diaspora Populations. My name is Kweku Adamako. I'm the manager of ABDGN, the African Black Diaspora Global Network on HIV and AIDS. And it is my deep, great pleasure to be here today. Before we start, I just want to say that I'd like to acknowledge the traditional owners of the land, the Wurundjeri people of the Kulin Nation, and pay our respects to the elders past and present. So a bit about ABDGN before we get started. ABDGN started at the 2006 Toronto International AIDS Conference, and that conference was pretty spectacular because there were 3 other global networks that formed during that conference. One was the International Indigenous Working Group. The other was the Global Forum on Men Who Have Sex with Men. And the third was ABDGN. And really, ABDGN is a reflection of the beauty of this conference, where you can have people who come together, build partnerships that actually are sustainable. And here we are, in 2014 in Melbourne, and ABDGN is still here. ABDGN is a network of networks based in Toronto, led by a governing council of 10 organizations based in the UK, France, the European Union, the Caribbean, the United States, Canada, and Australia. And our goal is to support the development and implementation of coordinated responses to African, Black, migrant, diaspora populations using a rights-based approach. This is the second time that we've had a regional session for African diaspora. The first one was at the last conference in 2012 in Washington, D.C., and the title for that session was Connecting the Dots. And really we were trying at that conference to sort of begin to share this picture of these shared disparities that we see amongst African, Black, diaspora, and migrant populations around the world. And one of the things I think that's been interesting in the HIV global movement is the discussions we have about key populations. And when you think about the number of people globally living with HIV, the majority of them are Black. That's something we really can't deny. And the racialized aspects of this disease are often not talked about. And that's why it's so critical for organizations and civil society like ABDGN to be here to create spaces to dialogue about these issues. I want to thank the IAS for supporting this session, the other co-chair, Marcus Day, from the Conference Coordinating Committee, for helping to bring attention to these important issues. I want to introduce now our moderator, Teresa Zakaria, an Indonesian national trained in medicine and public health. Dr. Zakaria has managed the International Organization for Migration Health Program in Yemen for the past 4 years. Her team has witnessed firsthand the suffering of migrants in their attempts to obtain better lives. The International Organization for Migration in Yemen assists over 30,000 vulnerable migrants, of whom over 3,000 are provided with life-saving health care. Dr. Zakaria.
Thank you, Kweku. Good morning, everyone, and welcome to this regional session. When Kweku first wrote to me asking me to be the moderator, I thought, wow, this is a great idea. It's a very important topic indeed, and especially because it is organized by the Black diaspora community itself. Indeed, as he mentioned briefly, HIV and AIDS disproportionately impact migrants and mobile populations in general, but notably African migrants within as well as outside of Africa. So this session will highlight emerging realities, threats, as well as opportunities to build a coordinated global HIV response for African and Black diaspora and migrant populations. So I was given the honor to welcome and introduce 5 prominent speakers, one who will arrive shortly. who will be delivering 5 presentations this morning. The first one is Ms. Wangari Tharau. She will be presenting she will be delivering a presentation on the Diaspora Declaration, development of a global HIV and AIDS framework for change. Her presentation will be followed by Dr. Christopher Lemos on promising seeds of change, the epidemiology of HIV amongst African immigrants living in the industrialized world. The third presentation will be delivered by Dr. Paul Semugoma from South Africa on resiliencies for change, sexual minorities, human rights, and mobility in the African context. The fourth presentation will be delivered by Dr. Valerie Delpech on sexual transmission of HIV amongst migrant populations in Europe, managing change in surveillance, interventions, and prevention. I understand that Dr. Delpech is presenting on behalf of Mr. Taimur Nori from the ECDC, who was in the end not able to come to this conference. The last presentation will be delivered by Mr. Phil Wilson on stepping up our pace, empowering Black perspectives in the HIV and AIDS response. Question and answers will be kept until the end, until everybody has delivered their presentation, so I hope everybody can cooperate on this matter. Ms. Wangari Tharau, who will be delivering the first presentation, is the Program and Research Manager at Women's Health in Women's Hand, a community health center for racialized women in Toronto. She is also a community-based researcher, an advocate, and currently co-chairs of the African and Black Diaspora Global Network on HIV and AIDS. The floor is yours.